A rare case of stroke in a rare disease. Cryptogenic stroke with thrombo-embolic pattern in a patient with unicentric Castleman's disease. First author, Dr. Nicolas Perez de Guzman. Attending and mentor, Dr. Mariana De Michele. Background. Approximately 30% of ischemic strokes are cryptogenic. Paradoxical embolism is most often linked to intracardiac right-to-left shunts, such as patent foramen avale. Extracardiac right-to-left shunts, or RLS, such as pulmonary atriovascular malformations and hepatopulmonary syndrome, are less common but clinically significant. Imaging studies used to evaluate such cases include transcranial duplex, or TCD for short, to detect the presence but not location of right-to-left shunts. Transthoracic echocardiogram and transesophageal echocardiogram identify intracardiac sources. CT angiography is often used to evaluate for possible extracardiac sources of right-to-left shunts. Approximately 25% of cryptogenic stroke patients have positive TCD with negative TTE or TEE. Limited data suggests this discordance is more frequent in patients with active malignancy. Case presentation. A 64-year-old female with a past medical history significant for unicentric Castleman's disease, diabetes, and metabolic syndrome, in addition to an 8-year history of breast cancer on hormonal therapy, presented to the clinic with a new complaint of daily headaches and dizziness. She had no previous history of migraines and no other focal localizing symptoms. In the clinic, her vitals and neurologic exam were unremarkable. Given the patient's history, a brain MRI was ordered which revealed enhancing lesions in the left frontal lobe, right cerebellum, and right postcentral gyrus. Subsequently, a comprehensive stroke workup was performed. As part of her workup, a transcranial Doppler revealed a severe right-to-left shunt. However, a TTE and TEE failed to identify any intracardiac shunts. She was started on anticoagulation therapy, with priority given to optimizing her diabetes and other metabolic conditions. A repeat brain MRI 6 months later revealed new regions of enhancement in the left parietal lobe and new lacunar infarcts. The patient was diagnosed with likely occult extracardiac shunt as a culprit of her embolic strokes. In the center, you can see a quick summary timeline of her MRI findings. Discussion. Extracardiac right-to-left shunts is an underrecognized cause of cryptogenic stroke with limited studies evaluating patients with TCD, TEE, and TTE. Approximately 67% of right-to-left shunt evaluations are TCD positive and TEE/TTE positive, suggesting an intracardiac right-to-left shunt. Conversely, approximately 25% are TCD positive but are negative on TEE and TTE, suggesting an extracardiac right-to-left shunt. Of the TCD positive and TEE/TTE negative group, only 70% underwent further workup. Potential mechanisms included pulmonary AVMs and active malignancy. In our patient, unicentric Castleman's disease is not inherently prothrombotic, but her breast cancer history, hormonal therapy, and metabolic disease likely compounded her thromboembolic risk, contributing to recurrent strokes via an occult extracardiac shunt. Conclusion. In patients with positive TCD but negative TEE/TTE, occult extracardiac right-to-left shunts should be considered. Identification and treatment of occult extracardiac right-to-left shunts may prevent recurrent strokes. Limited data exists on follow-up in TCD positive but TEE/TTE negative populations. A potential association between malignancy and extracardiac right-to-left shunts warrants further investigation. References are shown below.